Now we're going to discuss some points about the rectum. So rectum is the terminal part of the gut tube before the anal canal. The terminal part of the gut tube before the anal canal. Okay, right. Now the rectum is a continuation of sigmoid colon. Yes, at the S3 level, at the rectosigmoid junction. So continuation of sigmoid colon. Continuation of sigmoid colon. Okay, from S3 level. S3 level, what we have? The rectosigmoid junction. Fine. Now, I told you rectum means straight. The rectum is not a straight structure. We have some curvatures. Okay, so we have two curvatures in the rectum. One curvature is in the anteroposterior axis and other curvature in the lateral axis. So, in the first diagram, we are seeing anterior curvatures. In the first diagram, we are seeing anterior curvatures. In the second diagram, we are seeing lateral curvatures. We see one by one. Okay, right. So anterior curvature, we have two. One is sacral curvature and peridial curvature. So now we're going to see the sacral curvature. See, this is sacral curvature. Okay, so sacral curvature which corresponds with that is our sacrum bone here. So this is the sacral curvature of the rectum. So sacral curvature which corresponds with the concavity of the sacrum. Sacral curvature which corresponds with the concavity of the sacrum. Okay, now we have perineal curvature. Perineal curvature I'll draw here. Next curvature is the perineal curvature. This one. Okay, now that is a perineal curvature. So perineal curvature corresponds with the anorectal junction. Perineal curvature corresponds with the anorectal junction. Okay, right. So we have two curvatures in the anterior axis, anteroposterior axis. Okay, your sacral curvature and the perineal curvatures. Next, on the lateral side, lateral curvatures, we have three lateral curvatures, two right and one left. So upper lateral curvature on the right side, middle lateral curvature on the left side, lower lateral curvature on the right side. So we have three lateral curvatures, two on the right side, upper and lower, middle on the left side. Now, on the concavity of the lateral curvatures, we have some permanent mucus folds. Now these folds are called Houston's valve. Okay, so I told you the upper lateral curvature present on the right side. On the concavity side means I am talking about this side. On the concavity of the lateral curvatures, we have Houston's valve. Now how many valve we have? We have three valve. Why? I told you we have three curvatures. On the concave side, three valve. Okay, so Houston's valve are present on the concavity of the lateral curvatures. Present on the concavity of the lateral curvatures. Okay, now the first Houston's valve. First valve present on which side? It is present on the left side, opposite to upper lateral curvature. Okay, right. Now second valve present here. This is number one, this is number two. Now second valve is the most constant valve. Sometimes 1 and 3 can be absent, but the most constant valve, second one only, most constant. Now it is present on which side? It is present on the right side. It is present on the right side, opposite to the middle lateral curvature. Opposite to middle lateral curvature. Okay, fine. Now here we have third valve. Now third valve is present on the again left side, opposite to lower lateral curvature. Lower lateral curvature. Okay, right. So these are the three Houston's valve we have. I told you already. The second valve is the most constant valve. Damage to the second valve damage to the second valve, the most constant valve, which result in fecal incontinence. Okay. Yes. Now, one more thing we have to know in the rectum, the relations. Okay. Number one, peritoneal relations. Peritoneal relation is same in both male and female. Very simple. See the diagram. Now, this is the upper one third of the rectum, and this is the middle one third, and this is the lower one third, and this is the anal canal. So we divided the rectum into upper one third, middle one third, and the lower one third. Okay. Now this is anterior, this is posterior, and this is lateral. Okay. Now see the lateral part. The lateral part of rectum is covered by peritoneum only in the upper one third. I told you already, peritoneal relation is same in both male and female. So laterally, rectum is covered by peritoneum, okay, covered by peritoneum only in the upper one third. Is that clear? After covering that, the peritoneum descending down. Now see the middle one third. The middle one third is covered by peritoneum in the front side, but you're not having any covering on the lateral part. Coming from the lateral side, and then it is coming to the front side, covering the middle one third, and then reflecting to the bladder in male, in female uterus. So the point is, anteriorly, it is covered by, rectum is covered by peritoneum in the upper two third. That is the point. It is covered by peritoneum, upper two third. Is that clear? So middle one third of the rectum is covered by peritoneum only in the front side. Clear? Right. Now what about the posterior side? Posteriorly, rectum is not covered by peritoneum. No peritoneal covering on the back side. We have only bones and other structures. So posteriorly, no peritoneum. Posteriorly, no. We have don't. It is not covered by peritoneum, which is not covered by peritoneum. Okay. Right. This is the peritoneal relations. It is the same in both male and female. So peritoneal relation over. Next, we are going to see the visceral relations. The visceral relations for male and female. So please write the visceral relations. In male, anteriorly. Now, in the front of the rectum, what we have? Bladder. I told you peritoneum covering the middle one third in the front side and reflecting to the bladder and forming one pouch here. Now, this pouch is called rectovesicular pouch. That pouch is called rectovesicular pouch. So, anteriorly, we have rectovesical pouch. Rectovesical pouch. Plus, we also seeing bladder. Posterior surface of the bladder. Posterior surface of the bladder. Okay. Plus the prostate gland. Plus seminal vesicle. Plus the seminal vesicle. So these structures we are seeing in the front side. Okay. Male. Now next to female. Anteriorly. Peritoneum, after covering the upper two third of the rectum, reflecting to the uterus and forming one pouch here, that is our rectouterine pouch. So anteriorly we have rectouterine pouch. Rectouterine pouch. Plus we are seeing vagina. Plus we are seeing one ill-defined fascia, that is rectovaginal fascia. Rectovaginal fascia. Okay. This relation and relation of rectum in female. Now posterior, again it is same in both male and female. So posteriorly we have sacrum, and then coccyx, and then we are seeing anococcygeal raphe, and then sympathetic chain, median sacral artery. Okay, so many structures present. Just remember certain important structures. Okay, that is enough. Certainly they won't ask you. Mainly the question will be about the peritoneal covering. Okay, so these are the basic points you have to know in the rectum. So now we're going to discuss about the anal canal. So anal canal, which is roughly measuring about 3.8 centimeter. Now anal canal not having the features of the large intestine. That means anal canal is not having tinea coli, no circulations, and no appendices epiploicae. So unlike the other parts of large intestine, anal canal is not having any of these features, no appendices epiploicae. Okay, yes. Now this is a rectum, okay, and this is anal canal. Now see the lower part of rectum. So this is the lower part of rectum. The lower part of rectum turning backward and in turn continue as the anal canal. So please write the rectum lower part turns backward, okay, and continue, turns backward and continue as the anal canal. So this point is called anorectal junction, anorectal ring. So that is called the line, what I marked there is called anorectal ring or anorectal junction. Anorectal ring or anorectal junction, can call by any of this. Now anorectal ring or anorectal junction is formed by three structures. Puborectalis, part of levator ani muscle, and then external sphincter, external anal sphincter, external sphincter deep part, and the upper part of internal sphincter, upper part of internal anal sphincter. So anorectal ring is formed by these three muscles. Puborectalis part of levator ani, the external anal sphincter, deep part, and the upper part of internal sphincter. So we can't see these muscles in this diagram. Now see this diagram. Now in this diagram, yes, the section is taken in the coronal plane. Made a section in the coronal plane. Okay, yes, in the diagram. Now this is the anorectal ring, the anorectal line. The anorectal line, this line is formed by three structures. What are those? I told you. This is number 1, this is number 2, and this is number 3. That is anorectal junction, anorectal ring. What is number 1? Number 1 is the internal anal sphincter. Internal anal sphincter. Now, internal anal sphincter is a smooth muscle. It is a thickening. Yes, thickening of the circular muscles, internal anal sphincter. Number 2 is the puborectalis. Number 2 is a puborectalis, part of pubococcygeus, levator ani muscle. Levator ani muscle. Okay. Number 3, external anal sphincter. External anal sphincter. So external anal sphincter having three parts. See the diagram. Now this is the deep part. This is the superficial part. I'm writing SUP here. And this is the subcutaneous part. So external sphincter is having three parts: deep, superficial, and subcutaneous. Okay. So please remember, the external sphincter is the skeletal muscle. Internal sphincter, smooth muscle. So smooth muscles supplied by autonomic nervous system. We know that. The skeletal muscle, external sphincter, is supplied by pudendal nerve. Pudendal nerve, which branch? Inferior rectal nerve. Inferior rectal nerve. Branch of pudendal nerve supplies the external sphincter. Okay. Right. So please remember, anorectal ring or anorectal junction is formed by these three components. Okay. Now we're going to see the interior of the anal canal. In the interior of the anal canal, we are seeing one line here, a wavy line. That line is called pectinate line. Now above the pectinate line, the anal canal is having different artery supply, venous drainage, nerve supply, lymphatic drainage. The development source is different. Epithelial lining is different. Below the anal canal, they have a separate artery supply, venous drainage, nerve supply, lymphatic drainage, epithelial lining, and the source. So that is what we're going to write. Now above the pectinate line, we can say this part as upper part and this is a lower part. So this is upper and this is a lower part. Okay. So upper part and the lower part. So upper part of the anal canal means the area above the pectinate line. So below the pectinate line, lower part. So pectinate line act as a demarcation line or the watershed line. So pectinate line which act as the watershed line or demarcation line, watershed line. Now the upper part. So we're going to write the difference between the upper part and the lower part. So upper part of the anal canal means it is an area above the pectinate line. Area above the pectinate line. And lower part, that is the area below the pectinate line. Now, number 1, source. So upper part of the anal canal is derived from, like the other parts of GAT, endoderm. So upper part of the anal canal, it is endodermal in origin. Endodermal, okay, origin. The lower part of the anal canal, it is coming from anal pit or proctodium, that is ectodermal in origin. So the lower part, it is coming from ectoderm. Number 2, the upper part of the anal canal, it is supplied by our superior rectal artery. The area above the pectinate line supplied by superior rectal artery. Now, superior rectal artery is a branch of continuation of inferior mesenteric artery. The lower part is supplied by inferior rectal artery. Inferior rectal artery is the inferior rectal artery is a branch of internal pudendal artery. Internal pudendal artery. Internal pudendal artery. Okay. Now what about the venous drainage? The superior rectal vein, which is finally draining into portal system. Draining to inferior mesenteric vein to portal system. Okay. Portal system. Whereas the lower part, it is draining into inferior rectal vein, that in turn drain into internal pudendal vein. Internal pudendal vein. From the internal pudendal vein, they go to IVC, they go to caval system. So upper part of the anal canal drain into portal system, lower part of the anal canal draining into caval system. Okay. Next, nerve supply. So nerve supply, autonomic nervous system. Okay. And here, the nerve supply by somatic nerves. So pudendal nerve will supply. So nerve supply of the lower part by the pudendal nerve. Pudendal nerve or the somatic nerves. Okay. Now, if the venous radicals engorged, so in the area above the pectinate line, that is called internal hemorrhoids. So internal hemorrhoids nothing but engorgement of the venous radicals above the pectinate line. The engorgement of venous radicals below the pectinate line, that is called external hemorrhoids. Now, why we are saying this? Now internal hemorrhoids is coming from area above the pectinate line, supplied by autonomic nervous system. So internal hemorrhoids are painless. So patient, yes. So it is painless. So patient is having not any pain in the case of internal hemorrhoids. Now what about the external hemorrhoids? External hemorrhoids, it is coming from the area below the pectinate line, supplied by somatic nerve, pudendal nerve. So external hemorrhoids are extremely painful. Okay, right. Next, lymphatic drainage. The lymphatic drainage, the area above the pectinate line, the lymphatics draining into internal iliac nodes. Internal iliac nodes receive the lymphatics from the area above the pectinate line, whereas the area below the pectinate line, the lymphatics drain into superficial inguinal nodes. Superficial inguinal nodes. Okay, yes. So in every aspect, the upper part and the lower part of anal canal is different. Artery supply, venous drainage, nerve supply, the lymphatic drainage, epithelial lining. I forgot, no? The area above the pectinate line is lined by simple columnar epithelium. The area above the pectinate line, I am saying, is lined by simple columnar epithelium. The area below the pectinate line, the epithelial lining will be stratified squamous, non-keratinized or keratinized. We see later, don't worry. Non-keratinized or keratinized. Keratinized epithelium. Okay, right. So These are the difference between the upper part and the lower part of the anal canal. Now we're going to see in detail about the features of the upper part. Now in the upper part, we are seeing the longitudinal mucous fold. They are called anal columns of Morgagni. I'm talking about these columns. So anal columns of Morgagni. Now what is anal columns? See, anal columns are nothing but these are the longitudinal mucous fold. They are longitudinal. These are longitudinal mucous fold which contain the radicals of superior rectal vein. Which contain the radicals of superior rectal vein. Okay? Right. Next, we have anal valve. Anal valve here. I mark in black color. Now this is the anal valve. Okay. So anal valve, these are short transverse mucous fold. Short transverse concentric mucous folds. Concentric mucous folds. Okay. Right. Now they are present at the lower part of the anal canal. They are situated at the lower part of the anal columns. Now the position of the anal valves are indicated by what line? Just now I told you, no? This line is our what line? Pectinate line or dentate line. The position of these valves are indicated by, yes, indicated by pectinate line. Okay? Right. So now anal column over, anal valve over. Now between the anal column and the anal valve, we have a space, and that space is called anal sinus. Okay? So anal sinus is the space between the anal column and the anal valve. Anal column and the anal valve. Okay? Now the ducts of the anal glands, they open into the anal sinus. So ducts of the anal glands, they open in the lower part of the sinus. Open in the lower part of the sinus. Okay? One last point, sometimes the patient may have the rupture of this anal valve. The condition is called fissure in anal fissure. So anal fissure is nothing but rupture of anal fissure is nothing but the rupture of anal valve. Okay? Yet. Right. Now that's all about the upper part features. Now we're going to see the lower part. Now with the lower part also, we have one line. This line is called, yes, Hilton's white line at the mucocutaneous junction. So we have Hilton's white line, which is present at the mucocutaneous junction. It is present at the intersphincteric groove or intermuscular groove. Intersphincteric groove or intermuscular groove, present between internal sphincter and the external sphincter. Intermuscular groove. Okay. Right. So this is the Hilton's white line. Now this is the internal sphincter and this is the external sphincter. So that is why you are saying it is the intersphincteric groove or intermuscular groove. Right. Now in the lower part, we have two areas. Now this is A and this is B. Now A is present between the pectinate line and the Hilton's white line, that is called pecten area. So A is pecten area that is present between pectinate line and the Hilton's line. Between pectinate and the Hilton's line. Okay. Now the point is the epithelial lining, epithelium changing from simple columnar to stratified. The epithelium is stratified, squamous, non-keratinized epithelium. Non-keratinized epithelium in the pecten area. Okay? Right. Now what about B? B is present below the Hilton's white line up to anal orifice. That is called anal verge. So B is called anal verge. Okay. So anal verge is present below the Hilton's line. Okay. Now here the epithelium will be stratified, squamous, keratinized epithelium. Okay. That's all about the features in the lower part. Right. So the exams, they can give you the image based questions. They can mark the upper area, lower area, or any of the line can be marked, and they can ask you the questions. Okay. So that's all about the anal canal.